Thanks for tuning in today. I'm Dr. Nick, the Incrementalist. Join me as I seek out the small incremental changes being applied in other industries that we can learn from and that can be applied in healthcare. Can these changes bring immediate value, but also add up to the big improvements and revolution we need in healthcare? Come along with me to explore the possibilities. My innovative guests from around the globe have used small incremental improvements to achieve their moonshot. And today, I'm delighted to be joined by Deanna Parker. She is the Assistant Vice President of Emergency Services at Hardin Memorial. Deanna, thanks for joining me today.
Thank you so much for having me. It's a pleasure to be here.
So, given what's going on, I can only imagine that this is an extraordinarily busy time for the whole country and especially for people on the front line. So, first of all, thank you for making the time. For the benefit of the listeners, just tell us a little bit about your background and how you arrived at this role, if you would.
Sure. My background started in nursing, and I was a critical care nurse, and then made my way into a nursing leadership role, which just kind of was my passion. So I've had leadership roles over med-surg areas, telemetry, step-down units, and then I made my way into emergency services, which has led me here to Hardin Memorial Health. And so now I provide leadership to one of the largest emergency rooms in the state and help serve as the EMS liaison, oversee our SANE program and our urgent care centers.
Fantastic. So Hardin Memorial, where is it for those people that don't know?
We are located in Elizabethtown, Kentucky.
Okay. And currently, lots going on. We were talking before we kicked off. I think the numbers are changing, but Kentucky is enduring the same stress as every other state, but obviously at a different point in time in terms of numbers of COVID cases. Where are you in that sort of experience as a health system and as an emergency room system?
We are definitely not experiencing it to the level of New York and Louisiana. We have definitely had positive COVID cases, several thousand within the state now. Currently, we have not had a positive COVID case here at Hardin Memorial Hospital. I will also preface and say, though, that we have limited testing. There are still all of the precautions that we're having to take. I would say just by watching what's been happening throughout the nation, we're preparing for a potential patient surge and feel like that could happen in the next week or so as the virus continues to spread.
As you think about the whole concept of emergency room access, I think if we had talked as little as 4, maybe even 3 weeks ago, it would have been entirely different. You've obviously had to change the way that you approach patients coming in now because of the current pandemic and challenges. Tell us a little bit about that and the challenges as you think about it from a health system, as an emergency room services, and from your patient's perspective.
Yes, great question. And yes, just 3 weeks ago, we would have had a very different conversation. I laugh and feel like we've kind of recreated the wheel all over again. We have had to completely change things, even from how patients present to us. We had to transform our main entrance into the hospital into an emergency room only entrance, in which we now have established a pivot station. So there is a desk there, and we have a clinical person asking what the chief complaint is of a patient presenting. And we are doing that so that we can separate patients that are coming in with any complaints of respiratory or flu-like symptoms, wanting to make sure that we're following CDC recommendations and separating these patients so that they're not intermingled in with other patients that are coming in with broken bone or chest.
None of that stuff stops, right? It continues to happen.
Exactly. Normal emergencies and life are still happening. And so we have that pivot station now. And then if someone is presenting with flu-like or respiratory symptoms, they are directed to a completely separate area. So we're now triaging out of 2 separate locations. We've had to bring on additional staff to make that happen. The amazing thing is that we utilize Vocera communication in the emergency department. So even though we've now had to create an entirely separate area where we're placing these patients. We're still directly connected with one another by communication. But those patients are triaged in a separate area, and then as a room becomes available in the back, or if they're triaged and it's determined that they need to come straight back, we are then placing them in a room. And so we've got private rooms, so that way we can then follow the appropriate precautions as far as personal protective equipment. So, but that workflow is completely changed, and with us having the limited testing and not being completely sure, there's a lot of isolation equipment that's needed, which can definitely impact the flow of how efficient you are. And then there's just the challenges of making sure that we have all of the needed equipment.
And in fact, when we were first setting this up, the sort of original focus around this was about communications, which is a fundamental requirement for the clinical community. We face this challenge of, making sure everybody's up to date. And here you are, you've suddenly separated. Tell us a little bit about the lead up prior to this in terms of your communication strategy and, some of the thinking around putting in Vocera and the solution that you have there. What led you to that point?
Absolutely. So the emergency department here at Hardin Memorial, we serve a very large geographic area, about 10 surrounding counties. So our population is quite large. And so it was obvious that the emergency department was going to have to expand. So when I came on board, there was a renovation and expansion project that took us, we went from maybe about 16,000 square feet to over around 33,000 square feet. We went from 27 rooms to 65 rooms.
Wow. That seems like you had a vision that you were going to need all this, right?
Well, it's really interesting because it gets, the emergency department is bigger. We have all of this beautiful glass so we can have visual of our patients. And so everybody's thinking, oh, this is going to be great. But the reality is it was a large space. Our patient volumes were rapidly increasing. And so it actually became more difficult to talk, at least in the smaller space.
Right.
Staff were right next to each other and could say, hey, can you help me? They couldn't find each other anymore. So I knew we had a problem, and the community deserved better in the fact that it really affected our ability to be as efficient as we wanted to be. There had been a history of some long wait times. Left without being seen rates were extremely high. So I had utilized the Vocera communication platform in a previous organization. They had not used it in the emergency department where I was at, and thought, you know what, this might be really a game changer for us. So had the Vocera group come in and do a demo. Really needed to get the staff involved because we had a different ability to communicate through an app on the phone. It just did not seem to work in our busy emergency room. So saw over 75,000 patients. So typically churning through about, 220, 260 patients a day. Hearing a ding on a phone or trying to find it in your pocket when you're in the middle of a trauma room, it just was not working. And so
Right.
Compliance was low. So that's really what was the spark behind, we've got to be able to talk if we're going to provide the best care that we need to. It absolutely changed everything. And the great thing is the technology allowed us to completely rebuild our workflows. Whereas before, something that may have taken 2 phone calls and there was so much manual aspect to it, Vocera was able to help us go ahead and design, if we've got a code stroke that comes in, we need all of these people to be responding at the bedside immediately. And so all we can broadcast now, code stroke, and all of those people respond. I'm already thinking about, with our current situation and what we're seeing with COVID, how we're going to implement Vocera into response for that. It'll really depend on how this virus continues to grow and what we're going to see in our patients. But it's really allowed us to be more efficient. Left without being seen was honestly, when I came here, about 6%, and we're down to less than 2% now. Our patient experience scores have dramatically improved. Employee engagement has improved because the staff were frustrated. They couldn't talk to each other, and which made them feel like they couldn't take good care of their patients. Sometimes we forget it's just the simple things.
Right. No, it's right. It's that communication. And I think one of the key aspects to this that was there from your sort of concept as you built it and, the expansion, you couldn't shout across the room, or you didn't have that sort of almost the cooler effect when it was a smaller,
Yes.
more tightly knit community. But this is a hands-free solution, which was relevant then, but it feels even more so for the current environment where people are struggling with the personal protective equipment, or PPE as it's called. This works in that circumstance. Is that right?
Absolutely, especially when supplies are limited. Prior to having Vocera and having that ability to have hands-free, it would have been very normal for a nurse to have to completely ungarb from their isolation equipment,
Right.
come out, find a doctor, say what they need, only to have to go back into a room, put more of the isolation equipment back on. And that's not conserving resources, which is absolutely what we're needing to do right now.
And it's a risk to them every time they do that.
Every time, absolutely. So now the great thing is we can have a nurse or another physician, Vocera ED nurse room 12. It'll go directly into that nurse who's caring for the patient. They can continue care because they can answer it hands-free. All they have to do is say yes to accept the call, and they can have that communication, stay in the room, maintain appropriate protective equipment, and then help conserve those resources, but ultimately get the patient what they need faster too. So it's been amazing.
So for those of you just joining, I'm Dr. Nick, the Incrementalist, and today I'm talking to Deanna Parker. She is the Assistant Vice President of Emergency Services at Hardin Memoria. We were just talking about communications and PPE, and just to make the point, for those of you that have never sat in PPE equipment, I can tell you it is extraordinarily uncomfortable. And whilst we're encouraging and creating an environment that allows people to stay in it, I just want everybody to understand how extraordinarily difficult that is. But it's a good thing because it protects the individual that's delivering the care, and it smooths out everything from a patient standpoint. And that's achievable with communication that is hands-free, essentially, that allows people to communicate no matter where they are, which has been a great boon. Tell us a little bit about that experience as you've shifted. Obviously, you've now got this bifurcation of flow. You've divided up the hospital, the department in this process. You must be thinking about different communication protocols. You talked about the stroke one. What are you thinking about new protocols in the new environment that we're living in, and I think we'll be living in for some time to come?
Oh, you're correct. Really looking at it, we've established protocols for stroke and for STEMI and sepsis and those types of things. Now,
before you go on, could you just explain what that means to people when you talk about a protocol? Because not everybody understands that. What's involved in that?
Absolutely. So if we broadcast that on Vocera and as I mentioned earlier, say code stroke or code STEMI, that means that we have a patient presenting who is potentially having a stroke or a heart attack, or they are septic, and time is really saving brain and life and all of those things. So we need to deploy the appropriate personnel to the bedside so that way we can immediately start those time-saving interventions. And so by the use of Vocera, those protocols have allowed us to have the nurse respond, physician at bedside, so we can take a patient straight from EMS stretcher to CAT scan so they can receive that, understand if we need to deliver TPA. It's really built in around who is response, and then we can follow the protocols set by those guidelines. But Vocera has enabled us to have our TPA times and just our ability to get antibiotics on board faster have dramatically improved because our response is faster.
To make sure that everybody understands, what that means is you've got these resources that are distributed throughout your facility. They
Correct.
Could be doing anything, anywhere, but they all get essentially an alert at the same time with the same information, with arrival details and so forth, so that they can aggregate to be there and ready and prepared. Is that correct?
That is perfectly said. Absolutely. That is 100% what it does. Instead of having to try to find all of those individuals, a respiratory therapist, the physician, the nurse, all of the people that are necessary to be there, and multiple phone calls, and hoping that somebody may have heard their phone. We do not have those challenges now. When we do a broadcast alert, if they were communicating on Vocera, the broadcast alerts are the most important. So it will come through no matter what, and everyone knows when they've heard that, if that is their assigned job, they respond immediately. So you said it perfectly. Absolutely.
you've clearly got established protocols, and you touched on something else that I think is important. When you arrived, this was a technology, but it hadn't been applied in the emergency room. It's the reapplication of things that already exist in different circumstances, and I think you've got the same thing going on now with this new environment. So what are you thinking about, and how this can help you in terms of delivering care in this new environment?
As I think about this, and there's so much out there right now, and the concern with this new pandemic, and I am already starting to think about how we can potentially use Vocera to have alerts from, potential infectious disease process. Would we create a COVID alert of some sort, which would allow our staff to appropriately garb before a patient arrives? Right. As we learn more about this virus and the disease, my hope is that we can try to utilize this technology to create communication protocols that will keep our staff safe, which in turn also keeps the other patients safe that they're caring for. I mean, it's a ripple effect in healthcare. You've got to keep yourself safe, but you're going to be entering another patient's room. And so already thinking about how we can build some protocols and processes around that, because it's a real concern. Staff have safety concerns, and I know the public does too. This is changing people's lives. They can't get out, and it's scary for a lot of people.
So obviously, with all of the challenges that we've got going on, you've already started this process. I think you're at the early stages of it relative to some of the other states and so forth. Tell us a little bit about how it's impacted the facility, the staff, and indeed you. What's been the process since this all sort of started rolling out throughout the country, the world, in fact?
Yes, it is absolutely changed, for one, everyday life, but really healthcare is so much about people and caring for somebody during really vulnerable times. And it goes against the nature of a healthcare provider to have to restrict visitors and do these types of things when we have people that are really experiencing maybe the worst day of their life, and trying to balance that and help them understand that this is what's best for our entire community. But that's been very difficult, I have found, for the healthcare providers, and being able to express that message to families and loved ones that, especially in moments where you have people that are in the hospital still for childbirth, and these moments that should be momentous. And it's a definite challenge. I think the other piece is I'm seeing how the stress of all of it is weighing on our providers, and the concern around having enough equipment and putting themselves at risk. We technically put ourselves at risk every day.
No technical about it. You put yourself at risk.
Right.
You're at the front line. Let's not beat around the bush and be clear about this.
Okay, you're right. It just definitely seems like
you represent a typical clinician there. You're stepping back. No, I'm not important. No, I'm just doing my job. Let's be absolutely clear. Healthcare workers are on the front line of this. They are the most important and the most at risk. And to be clear, they're getting infected, certainly based on experiences, far worse than the average population. So I'm sorry to interrupt, but
I appreciate that. And I love that. It is definitely been a challenge. And I think a lot of things that we may have taken for granted because of that, we do have that kind of typical mindset as a clinician sometimes. And also that feeling of maybe being a little bit invincible because we're around it all the time. You kind of get numb and do it. There is just a heightened sense of stress around it. I think from my role, from a leadership perspective, it has completely changed my day-to-day in regards to every day is looking at processes. We're having to make a change immediately as CDC recommendations change. We have to then get to the drawing board. We're having to pull our physicians to the table and say, these are the new recommendations. How can we make that work here? How can we keep our patients and you safe? So every day is it almost feels like brainstorming and process development and it's extremely challenging because at the end of the day, you just want to do what's best for patients and staff, and it's much more difficult to do that right now. So it has a completely different feel when you walk through the hospital than it normally does.
So you mentioned it a little bit, but it's worth talking about because it's enormously significant. So your communication strategy and the ability to reduce the risk to your frontline staff from getting in and out of PPE and instances is a good thing from an exposure because it limits their risk. It's better for everybody. But there's also a background to that, which is you're trying to save this PPE equipment. What's the status of that in your facility, in your state?
That is honestly being looked at on a day-by-day, hour-by-hour basis.
Wow.
We're having daily task force huddles. We're monitoring specific equipment, really mask, N95 mask, and having capper supplies. That seems to be our greatest challenge right now. And so we have been working with the state and communicating our needs and working to get allotment from emergency management perspectives. It has definitely been a challenge. And again, it's literally every day where we're having to say we have about enough to make it for 5 more days, or we have enough unless we get another shipment in. And then you have to have a contingency plan. And it
right.
feels
What
like,
do you do when you run out?
Yes. And then it's almost as if we're creating contingency plans for our contingency plans, because if we have to go to a backup mask, there's still concerns in keeping enough supply of mask for the staff. So that is, I think, from a supply standpoint, what we're struggling the most with. That and hand sanitizer, but hand sanitizer isn't as bad as the mask. But
just remind me again which state you're in.
Kentucky.
I'm sorry, but isn't that the home of whiskey production? And aren't some of these whiskey folks swiveling to the production of hand sanitizer? I'm serious when I say that. I've seen
actually that there has been a local distillery that has reached out and is partnering with us, and so we are very.
New World Order, whiskey distillery partnering with a healthcare facility. I'm just going to say, as the whiskey librarian, I'm excited about that, and I'm excited that that's solving a problem for you.
I know. People are pulling together in really awesome and unique ways now.
Yeah, so I from my perspective, that's the positive in all this, is I see all of these folks pitching in ways that you wouldn't have thought of, people coming up. I continue to be troubled. I mean, the frontline protection of our staff, just from their own personal safety, their family, all of those things, just, seemed a non-negotiable item, but we're negotiating it because you're talking about it in that way. And seeing guidance on how to clean your PPE equipment and hang it in the oven at 70 degrees is just extraordinary additional stress. So I can only imagine what that means for you and the staff. We've just got a little bit of time left. Tell us a little bit about, if you can, and it's hard to imagine how you think about the future and, some of the developments and the things that you're doing. What's prime top of mind for you?
Staff safety, patient safety. So I think once the dust settles with all of this, it's going to be a huge learning opportunity for us to go back and really look at our processes, and specifically from an emergency management perspective, and really ensuring that we've got good connections with the state and resources and designed workflows to where we can come together, not only just from a local regional perspective, but from a full state perspective. So I would say that would be the biggest concern. I would also say after this, really looking at staff morale. What are we doing around that, and healthcare provider burnout?
Which was already a problem, but now probably even worse.
Yes.
Well, not probably. There's me, the clinician again. Okay. Yep. It's absolutely going to be far worse. But again, trying to find the silver linings in this. I applaud you for everything that you're doing. Appreciate you taking the time. We've run out of time as usual, so it just remains for me to thank you for joining me today, Deanna. Thanks very much.
Thank you so much for having me.
Thanks for joining me today. Do you have any better ideas, or have you found a small incremental change that's brought about a big improvement in your world? Let's continue the conversation on our hashtag, The Incrementalist, or share with me at Dr. Nick1 on Twitter. You can find more information about the show on our program page at healthcarenowradio.com. And tune in next time to hear my discussions with leaders and innovators from around the globe who've revolutionized their space by using small incremental improvements to achieve their moonshot. I'm Dr. Nick, the Incrementalist, and I'm starting a revolution through evolution.